Hi everyone, this is Andrea recording. I miss seeing all of you. I hope you're all doing well. To help prepare for the final exam on Wednesday, I'm going to give you a quick kind of overview summary again of the content that I taught you during Nursing Concepts. Just remember that your final exam is 50 points and the content number of questions from each content area is pretty evenly distributed. So let's kind of go through this together and let me know if you have any questions by reaching out to me via email. So the first section that I instructed you on was infection control. When I was reviewing to get this PowerPoint ready, I thought, oh my goodness, if I could teach this again to you right now, it would probably hit home. Or when you're reviewing this unit, please relate it to what's going on with the COVID-19 outbreak, because this directly relates to what we're experiencing and what nurses and healthcare workers, and for those of you working as CNAs, are experiencing right now. So HAIs, we talked about hospital-acquired infections. This would be like if someone were in the hospital setting and they acquired C. diff because the nurse that was taking care of them was also taking care of a C. diff patient and didn't use good infection control measures. Nosocomial infections we talked about. These are hospital-specific infections that are usually measured. So, for example, if a nurse puts a urinary catheter in a client and then that client ends up getting a urinary tract infection from that. Or if it's a setting where a central line is placed in a client and then the client gets a bloodstream infection from that central line. So it's an infection that the client gets in a hospital setting because as nurses, we did not use good infection control measures and we caused that infection to happen by doing that. We talked about the CDC. That's in the forefront right now. They're kind of the guide that's steering what we're following at the regional, state, hospital, everywhere. The CDC, that's the best resource that we have as far as public health and infection control measures that we follow in the hospital setting. Joint Commission also plays a role in that, specifically in hospitals. American Nurses Association, we talked about some others in class as well. There were a lot of key terms in this unit, so when you're looking back through your notes, just make sure that everything's coming back as far as those key terms. The chain of infection, remember there's 6 links, plays a huge role if you look back at that chain of infection and relate it to this COVID-19 outbreak. I don't mean to keep referring to that, but hopefully you can just think of that while you're reviewing and the information will really kind of jump out at you. Nursing assessment and implementation. So as far as infection control measures, we're making sure that we're trying to control portals of entry, promoting skin integrity, and other things as you're reviewing back in your notes. Infection classification. So when we talk about infections, we could use words like localized versus systemic. So localized would be like if I had a wound that was just on my hand that became infected, versus that a systemic infection would be when the infection gets into the actual bloodstream throughout the whole client. Acute versus chronic. So we talked about just different types of classification. Stages of infection, there's 5 different stages. Again, relates really well to the COVID-19. If you look back in your slides, the bell curve, flatten the curve, everything we're talking about, that's what we're talking about, stages of infection. So just look back at that. It'll be even more interesting to you now. Defense mechanisms and risk factors. So remembering that some of the things we deal with that were infection control wise, like MRSA, C. diff, things like that, VRE, some of these things are multi-drug resistant organisms. So for example, if somebody has a MRSA infection, usually that will only respond to vancomycin and things like that. Also remembering we have our primary, secondary, and tertiary defense mechanisms as well. Risk factors, thinking, to the outbreak, and also just anything with infection control. If somebody's a smoker, if they're immunocompromised, those are going to put them at greater risk. We did a worksheet about labs, white blood cell counts, sedimentation rate, things like that. So familiarize yourself with that again. Medical and surgical asepsis, we talked a lot about not only in the classroom, but also in lab. Different types of precautions, droplet, let me step back. Standard precautions, contact precautions, droplet precautions, airborne precautions. So remember, standard precautions are what we do with every patient. We wear gloves if we're going to, handle any specimens or anything that we would need to have gloves on. If we're actually just touching our patient, they're dry skin, they're not infected with anything. We don't have to wear gloves for that, obviously, but anything that would be secretions, or if the patient has any sort of infectious process going on that we could contaminate our hands with, we'd wear gloves for that. Dispose of sharps, all those things fall under standard precautions. Contact precautions are when we're wearing gloves and a gown. Droplet precautions are when we are wearing a face mask, gloves and a gown. Droplet precautions are usually used for influenza. Airborne precautions are when we are using N95 respirator masks that we have to be fit tested for. And I was reading literature from the CDC when I was putting this together, because I've noticed inconsistencies as far as it seems like we're kind of doing a combo of droplet and airborne precautions with the COVID-19. And a lot of that has to do with PPE and resources. And a lot of that has to do with, in order to wear an N95 respirator mask that actually works, you have to be fit tested for that, where you go through a drill where you wear a hood and they put these different scents in to make sure it's sealed. So just grabbing any random N95 respirator mask, if it's not fit to be the right size for you, is not going to do you a whole lot of good. So I fear that that could be going on as well, especially in just the general population. All right, and then PPE in general, we talked about donning, doffing, those types of things as well. So I think that is just a little overview for you about infection control. My disclaimer in all of this, is this is not just a breakdown of what will be on your test, but hopefully just getting you back into the content. And hearing my voice, I hope, will help you a little bit as well. So the next unit that I presented was perioperative nursing. So we're going to go through this. For the rest of the units, I kind of condensed it down to one slide for each. I just got excited about infection control because it's what we're living right now. Perioperative nursing, classification of surgeries. So looking back into your notes, there's 4 different classifications: degree of risk, the body system that's involved, degree of urgency, purpose, surgical risk factors, looking at our client's medical history, their age, their medications. So for example, if we were taking care of clients on a med-surg floor, a 90-year-old client with a long list of medical history that's taking a lot of medications is going to be a lot higher surgical risk than a 20-year-old client who has no medical history, who's of healthy weight, things like that. So just to think about those things. Preoperative nursing assessment and responsibilities. So there's a lot of detail about this in your notes. Our pre-op assessment, it's pretty in-depth. Not only are we doing a physical assessment, but we're doing an assessment of their medical history. We're doing an assessment of the medications that they're taking, when they stop taking certain medications like blood thinners. We're assessing their family or support system, who's going to help get them home from surgery, who's going to help take care of them when they go home from surgery. What's their occupation? So if they, are lifting heavy things in their job, how long is it going to be that they'll have to wait and heal before they can go back to that job? Pre-op, we're also looking at all their labs, specifically, especially their hemoglobin and hematocrit, their white blood cell count. We wouldn't want their hemoglobin and hematocrit levels to be too low before they have surgery, and we wouldn't want their white blood cell count to be elevated, indicating that there could be a potential infection before the surgery's even started. That consigned the signed consent form, informed consent by the provider, and that visual check for us as nurses that the client actually did put their signature on there. That all has to be done before they can go to surgery. Perioperative nursing. So this is when our client actually moves into the operating room. Timeouts are done. We talked about never events, just kind of what goes on in that setting. The different types of anesthesia we covered. Malignant hyperthermia. The very first sign of this is usually tachycardia. Remember, this is a life-threatening event. Does have kind of a genetic component to it as well. So that is something, if you have a family history or your client has a family history, we would be on heightened alert that that could potentially happen to you or to the client. Post-operative nursing care and complications. So after our client has surgery, they'll move into the PACU, the post-anesthesia care unit. Once they are stable in the PACU, then they'll either come back up to med-surg, or they will be put kind of back into the holding bays until they're ready to go home. For this course, we'll pretend they're coming back to med-surg. We'd get a handoff from the surgical nurses. We would do protocol of vital signs that are going to be taken frequently. We would do a head-to-toe physical assessment. And then we're always thinking about the complications from surgery. So we know surgery slows down peristalsis. It can make our clients not able to void urine or stool. We know all of the different monitoring we need to do of the surgical site, documentation, watching for drainage, watching for wound dehiscence, watching for any complications, redness, those types of things, how the client can care for that wound at home. We're also monitoring for things like atelectasis. So we need to encourage use of the incentive spirometer, encourage ambulation if they're able, all those types of really important nursing interventions and nursing cares that are going to help decrease complication risks after surgery. So that is a conclusion of the perioperative unit. Next, pain and comfort. So classifications, again, for this one, back into your notes. Physiology of pain, how we assess pain. So we talked about the different scales, the FACES scale, the numeric scale, making sure we're documenting, making sure we're using the WILDA acronym, and that our pain assessment is complete. We're asking all of the questions instead of just asking for a number. And also that we're really assessing the nonverbal cues that our clients give us, and realizing that we have different pain scales if our patients aren't able to verbalize. Non-pharmacological pain interventions. So we talked about all different types of things we can do. This is things like massage, using hot or cold therapy, distractions, those types of things. Pharmacological pain interventions and reassessments. So we talked about different medications that can be given, remembering, what are NSAIDs, what are things we need to watch for if our clients are receiving opioids. Pain reassessments are so important. So if our client receives a pharmacological pain intervention, or a non-pharmacological for that matter, but especially a pharmacological intervention, we need to know how fast that pain medication should work based on its route. So if it is PO, how long is it going to take? If it's IM, if it's IV, and then associating that with, that's when we're going to come back to the room and have our clients state their pain again, now after that medication has started working, to see if they're getting some relief or see if we need to try something else. And we'll use, their initial pain rating to help guide us in what might be the best medication choice for pain if they have multiple PRN options or things like that. And then we talked a lot about the gate control theory, so familiarizing yourself with what that was again and what that means. Bowel elimination. We talked about in this section the function of each portion of the GI tract, so starting in the mouth all the way to the rectum and the anus. Where does digestion take place, those types of things. So we kind of went through the whole GI tract. Remember, it's not a sterile system, so just keeping that in mind. We talked about the Valsalva maneuver. We talked about factors affecting elimination. So, for example, physical activity. We talked about that. You know, if somebody's used to being active and now due to an illness or injury, now they're not active at all, how that could affect their bowel movements, how decreased fluid intake can affect bowel movements, and there was a lot more we talked about on those slides. Constipation, we talked about, especially medications that can increase the risk for constipation, such as opioids. And then we also talked about all the different types of stool softeners that hopefully you've had a chance to give up in your clinical rotation. Fecal impactions, we talked about those. What's our management as a nurse? What do we need to keep in mind if our clients have fecal impactions? Diarrhea, how we're going to monitor that as a nurse, make sure we're documenting that, and then realizing that if our clients have diarrhea, they're at very high risk for skin breakdown, so monitoring and documenting skin integrity as well. We talked about hemorrhoids. We talked about bowel diversions. If our clients have ileostomies versus colostomies, what's the expected output, color, consistency, everything going to look like, and everything related to ostomies we talked about in class. Diagnostic tests, I'd given you a handout to get to class. We talked through that about x-rays, MRIs, EGDs, colonoscopies, barium swallow studies. So really being familiar with that, knowing that diagnostically, you know, where in the GI system is that test looking for? What are the nursing interventions we need to be aware of related to that, etc. So that concludes the 4 units that I presented in nursing concepts. Hopefully this kind of gets the ball rolling to help you study and just kind of get back into the content a little bit. If you have any questions, please feel free to reach out to me via email, and I will have all of the information posted when you're able to log into Care of Adults 1 after successful completion of this course. So again, please let me know if I can be of any help. Thank you.